My name is Linda, and I have suffered pretty much most of my life with stomach problems and have had diverticulitis for many years now. I've had several CAT scans, gone to the doctors many times to try to figure out what exactly caused the attacks. In the summer of 22, I had a particularly bad time. I basically had attacks every several months, wound up in the hospital several times, but with no results, with no definitive answers as to why those attacks were occurring and what foods could I stay away from, what food should I eat. There were absolutely no answers that were given to me by the medical people. So I had been thinking about seeking out a functional medicine doctor, and I started an internet search and found Dr. Jurgelewicz online and was impressed by his background and thought that it couldn't hurt to give him a call and see where that took me, since nothing else was working. So we had our initial consultation and we talked about the approach, which was extensive blood work as well as gut samples, stool samples rather, that analyzes your gut bacteria. So once the results of that came back, Dr. J identified the things that were high sensitivity in my body, medium and low, and we talked about a diet as well as supplements to try to strengthen the gut and to eliminate the foods that we thought might be causing the problem. That was actually in the summer. Even though I was starting down the routine, I hadn't had very good results. So I was getting a little discouraged. But Dr. J said to me, well, you're not taking anything to strengthen the gut. I hadn't started on a few of the other supplements yet. So I thought, okay, that has merit. And I started down the road with the particular supplements that he said would strengthen my gut. And that was in September of 22. And I'm happy to say that following the regimen that he gave me and taking the supplements that he recommended, I have not had an attack since September of 22. That may seem like a short time, but to me, it's a very wonderful thing. It's a long time given the state of my repeated attacks over the summer. So I'm very happy with what's happening right now. I am symptom free. I'm following the regimen that doctor prescribed, and I'm keeping my fingers and toes crossed that this just keeps on going. So if any of you are suffering from similar issues, gut issues, my best advice is to figure out what it is that's causing the problem, because you won't get any results from an MD. I believe that that's the first go-to with MDs is surgery in many cases. So that's not an option for me. I was trying to avoid that, and I would say that, you know, the best bet is to try to figure out your triggers.